So I just had a patient at the start of her appointment tell me that she stopped flossing because it made her gums bleed. And it never made her gums bleed before she got pregnant. So in her mind, she thought she would just stop altogether, and that made sense. So the question is, does pregnancy make your gums bleed? My name's Tricia D. I'm a dental hygienist, a Burst ambassador, and I'm pregnant. So who better to answer this question for you? First things first, let's start with a quick demonstration of proper flossing. You want to take an arm's length of floss, wrap it around those fingers, and get up in there. When you're going in between your teeth, you want to saw it back and forth so you're not popping it through too quickly and cutting your gums. And you want to make sure you create a C shape around your teeth to get under the gums and remove the plaque and food and bacteria. So let's see. Now, do you see any bleeding? Not in this case. We want to keep flossing. Don't ever give it up. So let's talk about these bleeding gums, or what we call pregnancy gingivitis. Pregnancy gingivitis is caused by an increase in estrogen and progesterone. The increase in these essential hormones can lead to an increase in blood flow to gum tissue and a decrease in your body's ability to fight plaque bacteria. Approximately 60 to 75% of pregnant women experience it. Typically, it happens between the months of 2 through 8, but it can last the entire pregnancy. What are the signs and symptoms of pregnancy gingivitis? If you get bleeding when brushing or flossing, if there's redness or a shiny tint to your gums with swelling, tenderness, bad breath, all of these symptoms are giveaways, but if left untreated, it can lead to periodontitis, where your gums can actually pull away from your teeth, creating pockets for bacteria to cause infection and can eventually lead to decay and tooth loss. So the big question, of course, is can pregnancy gingivitis affect the health of your baby? Periodontitis has been linked to preterm delivery and low birth weight in babies, which is why you always want to be on top of your oral health care. And of course, can you treat and prevent pregnancy gingivitis? Unfortunately, you can't change your hormone levels, but you can take other preventive steps. First and foremost, you want to schedule and keep regular appointments with your dentist and hygienist for them to monitor everything. We obviously recommend that you brush your teeth at least twice a day, especially after eating anything sticky or sweet, stuff that can get stuck in your teeth. We do recommend flossing at least once a day, even if you notice a little bleeding, just keep going. We also recommend that you rinse and gargle with warm salt water. Warm salt water is really just a teaspoon of salt and a glass of warm water. That helps to reduce any inflammation. You also want to make sure to eat a healthy diet rich in fruits and vegetables and lower your intake of sugary foods and beverages. Obviously, don't smoke or use tobacco products. And along with your OB, midwife, whoever, we also recommend getting tested for gestational diabetes around week 26. Diabetes will put you at an increased risk of inflammation and delayed healing, so you want to be on top of that. Obviously, and most important, don't ignore any symptoms. See your dentist if you notice anything serious or if anything's getting worse. Your dentist may prescribe x-rays, oral antibiotics, or a prescription mouthwash. The good news is your gums will return back to normal after pregnancy. However, if you're breastfeeding, your hormones are still wacky, so just be patient. I hope that helps to answer any questions you have about pregnancy gingivitis and bleeding gums. If you have any questions or comments, leave them below and make sure you subscribe to BURSTtv. Bye!